Good morning and welcome once again to our page. Today we are looking at Community Health Education and Primary Health Care, Lecture 1. Course Objective. Here we'll define health and nutrition, understand the issues of health and nutrition in development work, introduce health and nutritional system, use health and development modules. Module outline. Community health education will look at scope, terms used, aims and means, approaches, targets, key rules, principles. Then we'll look at primary care. We have origin, community health education. First, we look at the scope. See, health is a highly subjective concept. Good health means different things to different people, and its meaning varies according to individual and community expectations and context. Many people consider themselves healthy if they are free of disease or disability. However, many people who have a disease or disability may also see themselves as being in good health if they are able to manage their condition so that it does not impact greatly on their quality of life. World Health Organization defines health as a state of complete physical, mental, and social well-being, and not the mere absence of disease or infirmity. At the time of Alma Mater Declaration of Primary Health Care in 1978, health education was put as one of the components of primary health care, and it was recognized as a fundamental tool to the attainment of health for all. Lawrence Green defined health education as a combination of learning experiences designed to facilitate voluntary actions conducive to health. Now we look at terms used in this study. Information, education, and communication is a term originally from family planning and more recently HIV and AIDS control program in developing countries. It is increasingly being used as a general term for community activity to promote health. Information. Information is a collection of useful, brief, or detailed ideas, processes, data, and theories that can be used for a certain period of time. Education. Education is a complex and planned learning experience that aims to bring about changes in cognitive, affective, and psychomotor domains of behaviors. Communication is the process of sharing ideas, information, knowledge, and experience among people using different channels. Social mobility is a term used to describe a campaign approach combining mass media and working with community groups and organizations. Health extension is an approach of promoting change through demonstration, working with opinion leaders and community-based education activities. Nutrition education is education directed at the promotion of nutrition and covers choice of food, food preparation, and storage of food. Family life education refers to education of young people in a range of topics that include family planning, child rearing, and child care, responsible parenthood. Patient education is a term for education in hospital and clinic settings linked to following of treatment procedures, medication and home care and rehabilitation procedures. Behavior change communication. This is an interactive process aimed at changing individual and social behavior using targeted, specific messages and different communication approaches which are linked to services for effective outcomes. Advocacy refers to communication strategies focusing on policymakers, community leaders, and opinion leaders to gain commitment and support. It is an appeal for a higher level commitment, involvement, and participation in fulfilling a set program agenda. Aims and means. Health education aims at motivating people to adopt health-promoting behaviors by providing appropriate knowledge and helping to develop positive attitude, helping people to make decisions about their health and acquire the necessary confidence and skills to put their decisions into practice. Health education uses audio visual means, personal contact, direct talk, board role play, media, print media, mass media, social media. Approaches. The persuasion approach, that is the first approach, which is deliberate attempt to influence the other persons to do what we want them to do. The informed decision-making approach, giving people information, problem-solving, and decision-making skills to make decisions, but leaving the actual choice to the people. E.g., for example, we have family planning methods. Many health educators feel that instead of using persuasion, it is better to work with communities to develop their problem-solving skills and provide the information to help them make informed choices. However, in situations of serious threat such as an epidemic and the actions needed are clear-cut, it might be considered justified to persuade people to adopt specific behavior changes. Now, the target. Individuals such as clients of services, patients, healthy individuals, e.g. groups. We have example of groups: students in class, youth club, community. We have people living in villages. Interventions need to be planned in the light of the resources and organization structures peculiar to each setting. Communities, health care facilities, work sites, schools, prisons, refugee camps, and many others. Key rules. We have key rules: health education being the duty of everyone engaged in health and community development activity. Health extension workers, community workers are primarily responsible in working with the families and community at a grassroots root level to promote health and prevent disease through the provision of health education. Key roles: talking to the people and listening to their problems, thinking of the behavior or action that could cause, cure, and prevent these problems, finding reasons for people's behaviors, helping people to see the reasons for their actions and health problems, asking people to give their own ideas for solving the problems, encouraging people to choose the idea best suited to their circumstances. And we have as principles, all health education should be need-based. Therefore, before involving any individual, group, or the community in health education with a particular purpose or for a program, the need should be assessed certain. It has to be also specific and relevant to the problems and available solutions. Health education aims at change of behavior. Therefore, multidisciplinary approach is necessary for understanding of human behavior as well as for effective teaching process. It is necessary to have a free flow of communication. The two-way communication is particularly of importance in health education to help in getting proper feedback and get doubt cleared. The health educator has to adjust his talk and action to suit the group of whom he has to give health education. For example, when the health educator has to deal with illiterate and poor people, he has to get down to their level of conversation and human relationships so as to reduce any social distance. We look at the second principle, or we continue with principles. We see that health education is based on scientific findings and current knowledge. Therefore, a health educator should have recent scientific knowledge to provide health education. The health educators have to make themselves acceptable. They should realize that they are enablers and not teachers. They have to win the confidence of clients. The health educators should not only have correct information with them on all matters that they have to discuss, but also should themselves practice what they profess. Otherwise, they will not enjoy credibility. It must be remembered that people are not absolutely without any information or ideas. The health educators are not merely passing information, but also give an opportunity for the clients to analyze fresh ideas with old ideas, compare the past experience and take decisions that are found favorable and beneficial. The grave danger with health education programs is the pumping of all bulk of information in one exposure or enthusiasm to give all possible information. Since it is essentially a learning process, the process of education should be done step by step and with due attention to the different principles of communication. The health educator should use terms that can be immediately understood. Highly scientific jargon should be avoided. Health education should start from the existing indigenous knowledge, and efforts should aim at small changes in a graded fashion and not too ambitious. People will learn step by step and not everything together. For every change of behavior, a personal trail is required, and therefore the health education should provide opportunities for trying out change practices. Thank you very much, and see you in the next class. God bless you.